Hi, I'm Rick Fiene. I'm a research psychologist and regulatory scientist from Penn State University. And today I'm going to be talking to you about regulatory compliance measurement and monitoring systems. And we're going to go over some elements and key dichotomies that have been identified in the research literature. Everything I'm going to be talking about today is contained in this particular book that I wrote on licensing measurement and monitoring systems, regulatory science being applied to human services regulatory administration. It's available on the NARA website, as well as on my website, the Research Institute for Key Indicators, the data laboratory at Penn State. And we'll have an opportunity to kind of talk about that at the end of the presentation. I've got links to both sites so that it's easy to, for anyone to download the particular ebook and utilize it and everything. But like I said, in detail, I've got everything in there that I'll be covering today. So if you, have questions about particular things that I'm talking about today, my recommendation would be go to the ebook, download it, and use that as your reference for going forward and everything. So let's get into licensing measurement. What I'm going to do, the way I'm going to break this out is I want to talk about research that's been done in the field over the past 50 years. We've got a good body of research now that kind of indicates particular things that are happening in licensing measurement and its related monitoring systems. So I want to talk to you, about that, and then I want to talk about the implications, how all of that plays out for the design of monitoring systems, and then also the relationship between regulatory compliance and program quality, and what that might mean for you as a licensing administrator or a licensing staff person in your respective jurisdiction, either state, province, agency, wherever you might happen to be and everything. So the first slide deals with, the measurement elements, what we've been finding over the past 50 years in the field. As I said, my background is as a research psychologist. I've been at this for 50 years. When I started, when I got out of grad school and everything, I was focusing on child care, early care, and education. It was just coming into its own. This was back in the late 60s, early 70s. It was an exciting time. There was a lot of new things going on. Everybody wanted to know, would childcare be damaging to kids, kind of similar to, the research that was being done in orphanages. So it was a wide open field, and it was really, really a great time to be coming out of graduate school and looking at some of the key research issues, at that particular point and everything. But the thing that I found as I was looking, at particular research and everything, nobody seemed to be interested in licensing, which I found kind of interesting, because licensing essentially impacted everybody. I mean, if you wanted to operate in a particular state, you had to be licensed. I mean, it wasn't something that you had a choice or not. I mean, if you decided not to, you were operating outside of the law. Okay, not a good thing. So I started to look at that, and like I said, my fellow colleagues who were coming out and graduate students who were coming out of school were more interested in quote unquote the quality portions of the field in early care and education. But I was just intrigued by licensing, and I still am. I mean, it's a very very unique data set. One of the things, it's like no other data set that I've dealt with in social sciences. As a research psychologist and looking at, many different, data sets in early care and education, in child welfare, in child residential, licensing is extremely different than than anywhere else. And the interesting thing is, over the years, as a research psychologist, I've kind of morphed into quote unquote this regulatory scientist. When I came out into the field 50 years ago, regulatory science didn't even exist. Okay, we had regulations. Regulatory administration had been around for a number of years, and there was a lot of work done on how do you promulgate regulations, how do you bring them about. But there wasn't a lot of science related to it. But in the last 20 years, that's been a really a dominant field that is starting to come into its own. It's really kind of interesting. The thing, though, is it's dominated by the pharmaceutical industry, not by human services. I mean, this is something, I've been doing a lot of research in the last 5 to 10 years, and what I'm finding is it's just not, it hasn't kind of permeated into many of the other fields. And it's fascinating, but, it hasn't really kind of permeated out into other areas. So what I'm hoping to do today and in the future is to start to lay some of this groundwork, to take some of those principles from regulatory science and begin to apply them into the human services regulatory administration field. We've got to start to really think in terms of how can we develop, our particular science, our particular way of doing research and everything. So I'm hoping that this is a beginning, to start to do that, to start to look at what are some of the key regulatory compliance, measurement issues. So let me start, okay? Let's look at the first bullet. One of the things that I discovered very, very early on in looking at data distributions in the licensing field, lack of variance. All of the data are tightly grouped at a high compliance level. Now, from a statistical standpoint, that's a real problem, okay, because, the data are, there's very, very little variance, and very honestly, that's kind of a death blow when it comes to, statistical analyses. However, from a practical standpoint, it's absolutely wonderful because you expect, with health and safety rules and regulations, you want to see high compliance. You don't want to see a normally distributed curve. You would be very, very concerned if that were the case, because that's telling you that you have a lot of providers that are not providing a really high level of care. Okay, so, from looking at the data set, that's good. Statistically, though, it creates a lot of problems. And we'll talk about this a lot, and it has tremendous implications as we, move forward and start talking about monitoring systems and the relationship between regulatory compliance and program quality. So once I started looking at the distributions and kind of trying to figure out what's the role of licensing when it comes to, early care and education, one of the first things that came to mind, my other colleagues were in, the program quality field, looking at, the relationship of, what's the overall quality of early care and education. This is when the environmental rating scales were coming into fruition and everything. There was a real interest. Licensing was really growing tremendously because of the number of facilities. At that particular point, we still had federal interagency daycare requirements, which were going to kind of fall off the radar screen over time. But at that particular point, they were still, very, very important. So I wanted to find out, what is the relationship between regulatory compliance and program quality? I figured, this was a key question. We needed to find an answer to that. And when I looked at it, as any researcher, you set up hypotheses and everything, and I was assuming that we would find a linear relationship between regulatory compliance and program quality. It made sense that, as, compliance increased, the overall level of quality would also increase in a corresponding way, either measured through, the environmental rating scale or whatever other program quality scale that you would be using. So tested that out. I started in Pennsylvania, obviously, because that's where I was at that particular point in my career at Penn State. And sure enough, when we moved from a low level of compliance and we looked at quality wasn't all that great. All right. You move up to mid to substantial levels of compliance, and quality measures went up in a corresponding way. So again, there was that linear relationship between regulatory compliance and program quality. But the problem became when we started to move from substantial compliance into full compliance. In other words, everything was in compliance. There was absolutely no non-compliance at all. And by substantial compliance, I'm talking about, there may only be one or two items that were out of compliance. And generally, these were paperwork items. We're not talking about high-risk rules. We're not talking about lack of supervision. Okay, we're not talking about staff-child ratios. Nothing like that. These were generally always paperwork items. But in moving from that substantial level to full level of compliance, the quality was plateauing out rather than increasing at the same proportion as it was from low to substantial compliance. It began to plateau out, and in some cases, it actually dropped off. So here we had, programs that were in full compliance that quality-wise were not as good as the ones that were in substantial compliance. So this created a great dilemma for me, because the public policy at that particular point, going back 50 years ago, was that everyone had to be in full compliance. Okay, there was no issues about, if you weren't 100% in compliance, well, guess what? You're not going to be receiving a license. You're out of compliance. All right. But the data were not supporting that public policy. So this became a major issue, obviously in the field. When I presented it, at different conferences and everything, it was very, very controversial, obviously, because it went against just about all of the thinking at that particular point. And it also opened up a lot of other possibilities. Very honestly, without this finding, we could not have pursued things like differential monitoring or key indicators or risk assessment rules. There would have been no way to be able to do that because, again, let's assume that there was a linear relationship between regulatory compliance and program quality. Well, it would have been a no-brainer. Look, either you've got to be 100% in compliance or not. I mean, that was the key. But once you reached that substantial level and then went into full compliance and there was this drop-off, the question really became, it's not a matter of being in compliance with all of the rules. It's being in compliance with the right rules, all right? So that there are particular things, for instance, when it comes to paperwork items that very honestly probably are not as important as when it comes to, staff-child ratio, supervision, that all children are properly immunized, et cetera, et cetera, et cetera. All of these things that help to make for, mitigating the risk that children potentially might be in. Okay, so it really did create, a controversy in the field and in how we were going to deal with that. So this led us to, other things that came out of those particular studies. And I've done a number of these studies now and have replicated the findings repeatedly. I mean, this wasn't a one-shot deal. I mean, this is something that I've, over the decades now, over the past 50 years, I've looked at this because, like I said, it has had a tremendous impact in the sense of how you make licensing decisions and what should your licensing law look like, which then has impact on how do we monitor? regulatory compliance. So one of the first things, it's real clear. You have the third bullet down, difficulty distinguishing levels of quality between full and substantial compliance. I mean, that was the essence, okay, of this whole diminishing returns effect, that ceiling effect that I discovered there. That really kind of threw everything out of kilter when it came to making licensing decisions. Other things that really, that are very unique about licensing data, it's measured at a nominal level. Okay, what that means is either you're in compliance or you're out of compliance. Okay, there's no gray area. Now, some of that's beginning to change today. I mean, there does seem to be a little bit more interest in looking at, well, should we take partial compliance into account? For instance, you're counting records, you're looking at records. Does it make a difference that, out of all the records you reviewed, you only found one, as versus you found a systemic problem where there were, 8 or 10 records out of compliance? Should those two things be looked at differently? I've created a regulatory compliance scale to begin to look at that, to think in terms of, can we move nominal measurement to more of a ordinal type of measurement scale when we begin to include or infuse quality into some of our rules and regulations. I mean, this is a real interest area now. When we talk with a lot of jurisdictions, with a lot of states and provinces throughout the US and Canada, there seems to be a lot of interest in doing that, where 50 years ago, it was, rules and regulations were very, very separate from anything else. Okay, but back then also, we didn't have quality rating and improvement systems. Now we do. We have very robust professional development systems, accreditation systems. Well, we didn't have all of those things back in the late 60s and 70s. Now we do, and they're having an impact on kind of how the role of licensing is changing and how it's interfacing with all of these other systems and everything. Okay, we're moving more from that, that silo approach to more of an integrated way of looking at things. And I'm going to address this a little bit more, when we get into the whole monitoring aspects of, designing those types of systems and everything. Now, the other thing that, like I said, statistically, with the lack of variance in the data distributions, it was very, very difficult doing any type of statistical analyses. But one of the things that I did employ, which worked very, very well, but it's not recommended by statisticians, and I'm not recommending it other than in this particular case with, licensing data that are very, very skewed, is the dichotomization of data, okay? Because not only statistically, it doesn't make a great deal of sense to do that, where you're really separating out, those particular programs that are doing very, very well and those particular programs that are struggling, from a statistical point of view, but also from a theoretical standpoint. Like I said, let's take advantage of the fact that we are relatively good at distinguishing between those particular programs that are at a low level of compliance and those that are at substantial or very, very high level of compliance. That's one thing that is very prevalent in the regulatory compliance data. We can determine that. What we have difficulty with is once we get to those higher levels, that you have a great deal of difficulty distinguishing between the mediocre performers and the top performers. Okay. Now, other things that came out of all of these studies and everything, and this is still a problem to this day, the problem with false negatives and positives, especially with false negatives. Okay. Now, in fact, this is something that even within regulatory science, the FDA, where they're dealing with releasing particular drugs, making sure that particular tests are predicting correctly and everything. you don't want to have false positives. You don't want to have false negatives, especially false negatives. You don't want to have something that comes through that says, you're fine, you tested okay, you have no indication that there's any cancer. But when in reality there is, okay, you don't want that to happen. Same thing with regulatory compliance in the human services. You don't want to be making determinations that something is in compliance when in reality it is not, okay? Or when it comes to if you're using, differential monitoring and key indicators, and you go out with your key indicator tool, and it's saying that it's statistically predicting that you're not going to find any other areas of non-compliance. But the false negative is you do. Okay, we don't want that to happen. So I have built in particular safeguards to where we can control for that within the methodologies and everything, and this is just related to licensing measurement. This is where you want to make sure these things are not happening, and that's what leads us into this next bullet, which is of concern for me as a researcher. When I look at a lot of the things that are happening in states and jurisdictions and everything, is the lack of reliability and validity testing, where things are put out, but there's not a lot of reliability going across, licensors who are going out and actually doing the inspection, or validity testing to make sure that everything is working as it should. So we need to beef those things up, when it comes to regulatory compliance, licensing, measurement, as we move forward. As I said earlier, we do have ease in distinguishing between the levels of quality, between low and substantial compliance. We're really good at that. Okay, licensing systems, like I said, if that's all we had to do and not have to worry about that substantial to full, we're in great shape. And usually that's how, whenever I'm looking at high groups and low groups, I feel really, really comfortable in, the distinguishing and being able to discriminate between those groups. It's when we get up to that higher end that we start to have difficulty. And as I said, the first bullet, this last bullet is kind of just reiterating the fact that we're dealing with skewed data. Okay, the data that we're dealing with is not normally distributed. Okay, it's not like when you deal with the environmental rating scales, where you have very, very few that are at a very high level, very, very few that are at a very low level, and the majority of them are somewhere in between. When it comes to regulatory compliance data, it's all jammed up around being in high compliance. The problem is that by having them so compressed like that, we're having this difficulty distinguishing between those mediocre programs. They're okay, they're in compliance and everything, but they're not the best programs out there. Okay, they're not the ones that are the models that you want to take people to, and where the kids are in the safe, but the highest quality of care necessarily. So that's where you have to be careful in distinguishing between substantial and full compliance and the relationship to overall quality and everything. Okay, so that's kind of summarizing in a nutshell. 50 years worth of research and looking at this. Like I said, I've spent my professional life in doing this, because like I said, I was just nobody else was doing it. It's gotten lonely out here at times, in trying to look at all of the things that need to be done and everything. Although things are now starting to change, I have to say, over the last 5 to 10 years, there has been renewed interest in licensing, and looking at the relationship, the role of licensing in an early care and education arena. where, like I said, 50 years ago, this was not, something that, and it kind of bottomed out back in the 80s and in the 90s and everything. But there were a lot of things that were happening at the federal level and in various states. And I'm going to talk about that more in the relationship between regulatory compliance and quality, and coming up shortly in one of the slides and everything. But let's change. We talked about measurement, licensing measurement. Let's switch now to the monitoring systems. And this slide and the next slide that I'm going to deal with when it comes to program quality, I want to deal with dichotomies, because this just kind of made sense to me, and there's no real right or wrong answer here, okay? The previous slide is based on empirical evidence, okay? It's based on 50 years of research and coming up with things that I've pretty well replicated, validated. I feel really comfortable with those results, okay? Whenever you look at data distributions, you're not going to find a normally, distributed curve with regulatory compliance data. You will when you look at quality tools, but you're not there. I mean, that's just a given, all right? Now we're moving into an area that I want you to think about as a licensing administrator, as a licensing staff. Okay, you need to internalize these things. These are things that are going to impact how you approach your job day in and day out. There's not a right or wrong answer, okay, with any of this. It's just things that you need to think about as a licensor, as a professional in licensing, okay? But I wanted to put these out because, like I said, what I have found over the past 50 years, these were the things that always, when I would talk with people in various states or in doing presentations, these things would always come up. So I felt that, here and with program quality, the continuum, it made sense. Let's put it in terms of dichotomy. So the first one, and this one is directly tied back to the ceiling effect, where the studies that I've done that have developed or had kind of morphed into this theory of regulatory compliance. The dichotomy between substantial versus monolithic in the sense of how you approach a monitoring system. Is it something where you take substantial compliance and partial compliance into account, or is it essentially you've got to be 100% in full compliance and that's it? Okay. Now, sometimes you're driven by the law. Okay. Very honestly, if the law says you have to be 100% in compliance, you don't have any choice. Okay. But generally, what I have found is that over the years, many states, many jurisdictions have relaxed that thinking and everything, so that substantial has started to play into, where you can begin to look at, it doesn't have to be 100%, as long as they're meeting the intent of the law, and that, things, when it comes to risk assessment and everything, it's not like children are being left unsupervised or staff-child ratios or, over compliance or anything like that. But if there's a couple of, small, very lowly weighted items, that's okay. So that leads us into the next one, which really flows right out of this. Differential monitoring versus one size fits all. One size fits all is the monolithic side. Differential monitoring is the whole notion of abbreviated inspections, where you're going in and you're looking at particular rules or regulations. You're not looking at everything. You're looking at specific regulations or rules. The two dominant methodologies that are used in differential monitoring right now are key indicators and risk assessment rules. Okay. Key indicators are statistical predictors. In other words, they predict overall regulatory compliance. If you're in compliance with those key indicators, It statistically predicts you're going to be in compliance with all rules and regulations. Okay. With risk assessment rules, these are the rules that really place children at substantial risk for morbidity or mortality. Okay. In other words, every time you do an inspection, you look at these things. Okay. These are the things that can really, really injure children. Okay. And place them at risk. All right. The next item to think about in all of this, and with differential monitoring, one size fits all. I mean, this is something, you have to look at, where your head is at. Are you willing to make the leap to abbreviated, inspections or not? Or, you're set on, we're going to always look at all rules, one size fits all. You're not worried about compliance history with particular programs. Everybody's going to get the same thing. It doesn't matter if, this particular program has always been in compliance or this particular program is struggling. Everyone gets the same type of monitoring visit. Now, differential monitoring is part of the CCDBG reauthorization. Okay, it's encouraged. It's not required, but it is encouraged so that states, can look at it and see if this is something that they're interested in. Differential monitoring has grown over the years, very honestly. When you look at NARA's licensing reports and information that's coming out of the National Center for Early Childhood Quality Assurance, in fact, there's a wonderful report that was just completed by Trellis, where the role of licensing in early care and education. They did a wonderful report on differential monitoring that I highly recommend. And we'll talk about that when we get to the last slide. And I link you into some of the other websites and everything. Okay, the third particular bullet here, that are all the standards created equal or not? Are they, not all standards are being created equally. What's your philosophical bent on that is very, very important. This immediately leads to, in differential monitoring, the development of weights and risk assessment rules. Okay, if you believe that they're not all created equally, okay, so that supervision is more important and should be looked at more closely than if a particular program has every single signature, in all of their records, But again, it depends on what the signature is for and everything. I mean, I'm not making light of this. But I think it's important that you have to look at all of the rules and regulations. And there's specific methodologies for doing this, for coming up with weighting systems and everything. And later on, you'll see on the NARA site, reports that have been done that have developed risk assessment rules and key indicators and things along those lines. Another kind of dichotomy to think about is do things well versus do no harm. Usually when we think about do no harm, we're talking about a licensing system. When we're talking about doing things well, we're talking about quality initiatives, professional development, quality rating and improvement systems, accreditation, okay? But philosophically, it's a different way of looking at things, all right? Similar with, do you look at things from a strength-based or a deficit-based? Deficit-based is generally licensing. Strength-based is generally one of the quality initiatives. It's almost like, the glass is half full or half empty. With deficit-based, it's more risk mitigation. With strength-based, you're kind of an enabler. You're opening things up. Lately, there's been a combination with formative versus summative type of evaluation. You probably have heard of this in the literature. Combination of them in the whole notion of integrative monitoring, where now we're starting to think in terms of how do we tie regulatory compliance, and program quality together into one particular system, okay, rather than having them separate, like we do right now. We have licensing, but we have quality rating and improvement systems that have their own staff, their own monitoring staff that go out. Now we're thinking in terms of a lot of licensing administrators who I've talked with lately are kind of interested in how do we tie all of these things together. And then when it comes to program quality versus program compliance, again, licensing versus quality. How much emphasis do you place on one versus the other, or your agency does? I've seen this happen many, many times. A new administration comes in and quality is just a no-no word, okay? You don't have the opportunity to really focus in on that. It's all, let's just deal with the rules and regulations, and you don't go beyond it, all right? Now that has implications for scoring, how you approach your monitoring system. Is it on a scoring system where it's 100 or 0? Or is there gradients, okay, of 100 through 0 so that, you can get intermediate scores? This is the whole notion of partial compliance, okay? As I mentioned, the differences between quality rating improvement systems, QRIS, versus licensing compliance with health and safety. Where do you fall? One end or the other, or is it a balancing act between the two? How well is the quality rating and improvement system tied to the licensing system? Do they talk to each other? Is there any health and safety in the quality rating and improvement system? Is there any overlap like that? Another thing, nonlinear versus linear relationships. I mentioned this earlier about that was one of the major pieces that I found, 45, 50 years ago. My thinking was that, there was going to be a linear relationship between regulatory compliance and program quality, but there wasn't. There's this non-linear relationship, and it has been demonstrated time and time again when you look at this. Also, when it comes to monitoring systems, the balance between effectiveness and efficiency, okay? Effectiveness where, you're meeting the goals of your particular program, and you want to do it in as efficient a way as possible, but there are trade-offs here. The more efficient you become, okay, effectiveness is impacted by that. And the more that you depend on effectiveness, you start to lose efficiency. What is the right balance between technical assistance, okay, and enforcement actions? How do we determine that in everything? Okay, it's a wonderful research question. We don't know yet, okay, but we have to build the systems to be able to move forward in that way. And then lastly, the two bottom items is the relationship between anecdotal versus instrument-based. How much of it is written down and in case studies versus instrument-based where things are on checklists. A balancing act. In the research literature, it's combining the two. Okay, where you do have some case studies, but most of it is driven quantitatively, okay, on this end. This is more qualitative, okay, kind of a mixed methods type of approach. And then lastly, and this is very, very important, the federal government is very interested in coordinated monitoring, so that you don't have monitors going out, monitoring the same program, collecting the same data, but just at different times. That's kind of a silo approach. How can we better coordinate and be more efficient, in doing that? So those are some of the dichotomies. And again, there's not a right or wrong answer, okay? And in some cases, it's going to be determined by, larger factors than you can control. For instance, if the governor has a particular bent and says this is the way we're going to approach these things, either you you go along with it or you find another job, right? I mean, that's what happens with these things and everything. So it's okay. So let's move on. Okay, so on this last slide, what I want to do now is relate everything to the program quality continuum. Again, within dichotomies and everything, there's going to be a lot of repeating here, but I think it's important because it kind of ties everything together. All right, so the first item, okay, on the list is do no harm versus do good. Obviously, do no harm is more on the licensing end. The do good is more on the quality end. It's risk aversion, versus, moving forward and being more of an enabler. And another way of looking at this is kind of closed system versus an open system. In a closed system, people have to enter into it. Okay, so licensing is like that. It's like a gatekeeper. You have to meet particular rules and regulations. In an open system, kind of quality initiatives, it's more open-ended. All right, you don't have as many rules and regulations that you have to meet. There's not a gatekeeper function. You want people to kind of, stretch the system. There are many, many different ways of attaining a quality program. Another way of looking at it is rules versus indicators. As I said, rules are more tied to licensing, while the indicators would fit much more into the quality side of things. Other things to consider: nominal versus ordinal measurement. Nominal, right now within licensing, is the predominant way of measuring regulatory compliance. Ordinal measurement fits more into the accreditation side of things, quality initiatives, where there's a Likert scale. Okay, you can be in compliance, you can have partial compliance, or not compliant at all. And I think that this is going to kind of be the wave of the future. I kind of indicated that earlier in the slides, that I see things moving in that particular area. Also, the difference between full versus partial compliance. That's going to play out, with a program quality, continuum, and influence you, tremendously in the sense of how you take all of this into account. And then from the first slide, you remember, is there a ceiling effect versus no ceiling effect? Okay, no ceiling effect, it's very open-ended. This is where quality has really been infused into the respective rules and regulations. And you do see when this happens, okay, because I've seen some systems where they've taken particular standards where there was a ceiling effect, and if you add and you infuse quality into that system, that ceiling effect begins to drop off, and you see more of a linear relationship play out. And then, and I've said this a number of times over this presentation, the role of gatekeeper versus enabler. Gatekeeper is generally, associated with the licensing systems, while enabler is the quality initiatives and everything that plays out. Another way of looking at it is risk versus performance. You want to reduce the level of risk as best you can. You want to keep kids healthy and safe, but at the same time, you want to give them a really creative, open type of environment to explore. So there's a dynamic tension there, and how that plays out. And you see it in structural versus process quality. Okay, structural generally has to do with licensing type of things that are easily countable. All right, versus process quality that gets into things like, measuring the interaction amongst kids and staff, or the last one, and this is where attorneys and legal counsels get involved, the difference between hard and soft data. That's how they look at kind of this structural versus process quality. Again, things that are easily countable versus things that are a little tougher to defend in the court of law, for instance. So anyway, let me finish here with, you know, this particular piece. Let me, for the time being, let me click on the final slide, because this has my contact information as well as some links, which I want to take you to, you know, real quickly before we close out the session. But really, this is the first, I hope, in and if you follow through with this, start with this, you know, this short little presentation where I've just given an overview. I mean, a really, really brief overview. Read my book, all right? Look at that, okay? It's free, all right? Just download it, take a look at it and everything. And then from there, I'm going to show you a couple of links that you can go to the NARA site. You can go to my Research Institute for Key Indicators Data Laboratory. Everything that I've talked about is on one of those two sites, okay? Everything that I have, okay, that I've ever published is in the public domain, okay? You're free to download it and to utilize it. That's what I want to do. I mean, I'm a firm believer in open science, in being able to share things, you know, very, very broadly and everything. So, you know, please check these things out. But here, let me just take you to my particular website. It'll just give you a feel for, you know, this describes all of the research that I've done. It has an intro paper. I keep a blog. I mean, if, you know, that's something you want to follow, any of the latest developments in the field. It's approaching 300 posts on it and everything. There's a lot of information there. Take a look. And I also have a listing of all my publications. Okay, they're all here. You know, feel free to download them. All my presentations, everything is here that I've written about licensing, measurement, and monitoring systems, and now with regulatory science. So take a look. Like I said, it's all freely available. You know, you can download it, put it on your computer. You know, utilize it however you'd like. You know, that way. And also, let me just show you real quickly in the time. You know, we have remaining and everything. Okay, so this is the NARA key indicator page. All right, and this has all of the basic information that you need. I mean, they've done a really, really nice job of putting this all together on one page, distilling out the key things related to this methodology. So, you know, it's short and sweet. It's got some introductory statements up here at the beginning, and then it goes into key indicator resources. It's got a series of papers. Here's the ebook, okay, right here is right here. So all you have to do is click that on and you'll get the ebook that I presented to you at the beginning of this presentation. And there's a whole bunch of other useful information that I think you can really, really use in your respective state or province or agency. And then I had mentioned to you, NARA has also done a number of studies and projects, and they're all listed here, as well as all of the reports. So I would really encourage you to look at this, because, again, as I said, I've devoted, you know, the past 50 years on, you know, looking at licensing, measurement, and monitoring systems. We've come a long way, you know, during those 50 years, but we have a long way to go. You know, we've started to really to validate, you know, all of these approaches, and everything is standing up very, very nicely, you know, in the validation studies. But we have to begin to move the needle towards looking at outcome studies. For instance, a study that's really begging to be done is looking at regulatory compliance. And remember, I had said I've done a lot of studies comparing it to quality, but looking at regulatory compliance and looking at, are kids safer? Okay, what does the injury data tell us? All right. Does regulatory compliance, correlate with, kids, not getting injured in the particular programs, more case, versus those particular, programs where there's a higher level of non-compliance, especially when it comes to staff-child ratios, supervision, and children being injured. So there's a lot that still needs to be done. And what I'm hoping for is that, very honestly, that, we can continue to partner. I've worked with many of you. I'm hoping to work with more of you as the years go on in designing these studies, in being able to really move the needle, continue to move the needle forward. The licensing field is very, very exciting, especially right now. There's a lot of really, really good things going on. It's getting more visibility. The influx now of regulatory science, although I know it's in the pharmaceutical area, I'm hoping we can do a more closer merger between regulatory science and the human services as we move forward. So I'm hoping that this kind of percolated some thinking in the sense of how you approach, your thinking about licensing in your particular jurisdiction and everything. So, I'm going to end there, and, if they're, on the final page, my email address is there. Email me if you have questions about anything, or if there's, you need help with something, or you read some of my stuff and you go, what the hell is he talking about? Email me, and let's keep the dialogue going and everything. I love doing this stuff. I love being able to work with you and everything. And so I'm hoping that through NARA's initiatives and everything, we can continue this licensing, measurement, and monitoring system journey together. So thank you so much, and I look forward to hearing from you. All the best.